Hi, Dr. Gerardi.
Good
You just
morning.
got done with a treatment?
Yes, we
Okay.
did. Just got a couple of shock waves going today.
Perfect.
Also some pellets.
Nice.
And one of the things I wanted to talk about today is the pellets. So the bioidentical hormones are very important. The hormones you're taking, the testosterone you may be getting elsewhere, may not be binding to the receptors, may not be effective, and you may be wasting your time and may actually be doing you harm. So you got to really do the bioidentical. It's important. It works better. You'll feel better, and you can definitely get better results. Not only that, even the Viagra type medicines, some of them over the counter, you get like these, you get them in the gas station or whatever online. They just don't work as well, and it's not the real thing. You got to be monitored on all these things. You got to check your blood levels for the hormone replacement. We got to check your estradiol. We got to check all these things to make sure you're getting optimized.
Perfect.
Take care. Have a good day.